Hello, everyone. My name is Maribel Sabio, and I'm the program coordinator for DC Health's Project Firstline. Welcome to our first DC Health Project Firstline and American Nurses Association Real Talk Infection Prevention and Control for Nurses by Nurses webinar event. For today's event, we have a group of experts that will discuss important issues that are relevant to your role as nurses. I want to give the floor to our host, Kathy Chapman. Kathy, you have the floor.
Hello, everyone. My name is Kathy Chapman. I'm a family nurse practitioner and a technical advisor on the COVID response team for healthcare facilities at DC Department of Health. We're here today to discuss current variants of concern and what it means to be up to date with the COVID-19 vaccine. We are very fortunate to have esteemed colleagues and panelists, Christina Willett, who is our outbreak investigations team lead. We're also honored to have Dr. Kimberly Sommers, who is our interim scientific officer as well. After answering the questions, we'll have a mini presentation from American Nurses Association guests, Sandy and Rashida. So as we dive into the questions, first and foremost, I'll defer to you, Dr. Willett. What's the difference between community level versus community transmission?
Thank you, Kathy. So community transmission is what we had all been talking about until about March of 2022. That is a reference to how much COVID is actually in the community and how it is spreading. As the new variants came about and we saw less severity in disease, CDC moved to a community level module for communities and health departments to be able to understand where we stand in regards to the strain on our healthcare system. So a community level takes into consideration the weekly case rate, and then as well as that, also how many new hospital admissions there are that are actually due to COVID-19, how many confirmed positive cases were hospitalized, and then how many beds are actually being occupied by patients with COVID-19. So this combination of metrics helps us better understand where we stand as a community to be able to serve the community better as it relates to the strain on healthcare due to COVID.
Kathy, there you go.
I was going to say thank you for that. What does it mean to stay up to date with COVID-19 vaccine? And does that include only one booster or two?
Hi, this is Dr. Definition of depends on your age and the time since your last. So up to date is an evolving term, advising what it means to be up to date as new information comes out and new recommendations come out for vaccinations and boosters, et cetera. So if you're 6 months old to 4 years old, up to date on your vaccine just means you've received the full primary vaccine series. If you're 5 years old to 49 years old, it means you've had the primary series plus one booster. And if you're 50 or older, up to date currently means you've had the primary series and 2 boosters. So the caveat of this is like if you're eligible. So if you're in the time where you have to wait 5 months after your final dose of your primary series to get your first booster. So if you're within that time frame and 5 months hasn't passed, then as long you're still considered up to date until 5 months have gone by, and you're now eligible to take your booster shot. The same applies for the second booster shot. So if you're fully vaccinated, if you've gotten your primary series and your first booster, you can wait 4 months. You're supposed to wait 4 months to receive your second booster after you received your first booster. So that's the gray zone where if it's not time, if you're not due for your booster, yet, then you're still considered fully vaccinated until you reach that time point. So there are also, I just want to mention special recommendations for vaccination for people who are immunocompromised. And all that information can be found on the CDC website. As a matter of fact, I recommend healthcare facilities and healthcare professionals frequently, and also the public, frequently check the webpage at the CDC called Staying Up to Date on Your COVID Vaccine, because that's really updated. It seems like almost every few days right now. So in order to be square with this definition that's in flux all the time, best thing to do is check the CDC website.
Let me throw this out to the panelists. Are the current vaccines, this is a common question that we get, are the current vaccines against the new variants of concern effective? And if not, how can I protect myself from others who choose not to wear a mask, and the government no longer requires masking? In other words, people are asking, nobody requires masking. I have to wear a mask, or I don't have to wear a mask, depending on the government saying it, and how does that protect me?
Yeah, so that's a really good question. So we know that ever since the Omicron variant and its sub-lineages have arrived, we've seen increased what we call immune escape, meaning even people, I'm sure everyone has known people and been aware of people who've been fully up to date, boosted, and yet they still have caught COVID-19. And that's something we definitely have seen. And also the Omicron variants have been more contagious. So those two things coupled together mean we've seen a lot more cases, breakthrough cases in people even who are fully up to date and boosted. But the one thing to take heart in is that we are still finding that the COVID vaccine is highly effective at preventing severe COVID-19. In other words, the type of COVID that's so bad that it requires you to go to the hospital, or up to being in intensive care, or up to death. So that's the message that we really want to make sure is understood at this time, is that the best protection against severe COVID-19 is in people who are up to date on their vaccine. So that's important. So if you're in a situation where you're around a lot of environments where people aren't required to wear masks anymore, and you're concerned about that, well, obviously you could still choose to wear a mask yourself in any setting, and we've been pretty forthright about that people still can decide. People have the right to decide that they are comfortable and want to continue wearing a mask in any setting, and they shouldn't be made to feel bad about that. So the other things you can do to protect yourself are kind of coming back to our core COVID-19 prevention measures that we've recommended through the whole pandemic, which is continuing to practice all the recommended infection control and prevention practices, hand hygiene, those are, social distancing. All those things are still protective and extra measures that you can elect to continue to add added protection for yourself.
And I want to thank you for that, Dr. Sommers. That was very pointedly put, and I think helpful for the members on this WebEx to say for sure. I think the next thing is, where can one find the resources for infection prevention and control? You mentioned CDC. We have DC Health website, DC Health guidance. Our coronavirus guidance is very detailed and an effective means of communication of what people need to do. DC Health Project Firstline, you can enter that in the search box of Google and get it, and then the American Nurses Association website. So we're just about out of time, but I want to thank Dr. Sommers and Christina Willett and for joining us today. Before we end today's event, I would like to ask Sandy Cayo and Rashida Jones to offer what they have for the American Nurses Association. This is important because it targets nurses specifically, not just all healthcare workers, as far as Project Firstline is concerned. Ladies, you want to take it away?
Yes, good afternoon, and thank you so much. So myself and Dr. Jones have been working with ANA Project Firstline over the last several months and years. So we're really excited just to share a little bit about the resources that are available for nurses by nurses. So essentially, if you can go to the next slide. CDC is partnered with the American Nurses Association as one of its funders to help disseminate information around Project Firstline infection prevention basics. So there's 3 cohorts of information that we'd love to share. There are tons of on-the-go resources, videos, there's downloadable infographics, and resource links. So these are easily accessible to anyone who's interested in doing infection prevention training education. These resources are also easy to co-brand and utilize if folks would want to use them and disseminate to their healthcare organizations. And then we also have CNE education courses that my colleague Dr. Jones is going to talk a little bit about some of the work that we've done in developing modules specific to nurses that were really created by nurses. And then there's Project Echo, which many of you might be familiar with. It's a telementoring series that looks at IPC fundamentals and basics. Again, we've had at least 2 of these Echo series thus far that were very successful, and we've gotten tons of engagement. And we plan on starting another series this coming fall. So we will be sharing and disseminating that information and just important tips on how you register for these programs as well. I'd like to now pass over the presentation to my colleague, Dr. Rashida Jones.
Hi, everyone. Next slide, please. This is Dr. Rashida Jones, nurse planner for ANA Project Firstline, and I am excited to talk a bit about the CNE education courses that we're very proud have been developed by nurses and are for nurses like yourself. I'll start by sharing a bit of the educational design for our content that has been co-developed by the CDC. We first started by listening to nurses. Of course, before planning any educational intervention, a needs assessment really helps to identify, knowledge gaps and really determine the full spectrum of learning needs. And so ANA released a total of 3 insight surveys, and approximately 1,500 registered nurses responded with really important feedback. And these surveys really addressed a variety of IPC or infection prevention and control related topics. Some of them were around hospital-acquired infections, personal protective equipment, and safe injection practices. So each survey response revealed really great quantitative and qualitative insights that really helped ANA Project Firstline team to develop these IPC-focused content CNE education courses for nurses. So we really wanted our products to resonate with nurses and the unique practice environments that we all work in day to day. And so we partnered with nurse subject matter experts to help co-develop these educational materials. And those nurses were from a variety of backgrounds: clinical, academic, executive, and also in researcher roles, participated again in developing this content really to provide an inclusive and comprehensive perspective to the content. IPC core principles were also integrated in the foundation of nursing education curriculum. that really guided nursing practice. And so we applied the IGNITE model. This is an evidence-based, brain-based learning theory. It's specifically designed for online course. It's really helpful in increasing learning retention and end-user engagement. So our courses are really exciting. They're really engaging, and they really have an innovative spin to them to keep you all interactive and engaged. We also followed guidelines to ensure that the content met the American Nurses Credentialing Center for Accreditation Standards for Nursing Continuing Professional Development. Next slide, please. So our first CNE module was launched the end of January of 2022. It was titled Injection Safety, and 2 modules have launched since then. You know, the conversation of COVID-19 that we've talked about today is extremely timely. We know that nurses are on the front lines of administering injections. Maybe you're answering questions that patients may have about the injections. And so the injection safety module really informs and refreshes your knowledge on precautions and best practices to prevent infection before, during, and after injections. We know that multi-dose vials are used to administer COVID-19 injections, as well as other important medications in a variety of settings. And so the multi-dose vial infection prevention practice module is also available to you, and it will help you understand how to mitigate the risk associated with multi-dose packaging and essentially how to prevent infections. In addition to these 2 topics, as you can see to the right of the screen here, there are more topics to come that are in the pipeline that we'll be launching throughout summer of 2022. We have received an overwhelmingly positive response thus far in participation and an evaluation of these CNE modules that have launched. As of date, over 1,500 courses have been completed by nurses, and over 2,000 contact hours have been distributed. So we encourage you to please take advantage of these free, easy to understand, and very relevant IPC courses and resources that are designed specifically for nurses and by nurses. Sandy, would you mind just chiming in and letting the folks know where they can find these resources? Next slide, please.
Yeah, of course. Yeah, please feel free to check us out on our website at www.anaprojectfirstline.org, as well as email us at projectfirstline@ana.org. We look forward to partnering with you all and helping to support and improve infection prevention and control for all of our patients. Thank you so much for this opportunity.
So I want to thank both Sandy and Rashida for that presentation. It's really important when we talk about COVID-19 to meet our participants where they're at, and at their educational level where they're at. So I think it's important that we have one for nurses as well as for general healthcare workers to reach them, to understand what their questions and concerns are, and to move forward. But I want to remind everybody in closing that we are moving into warmer weather. COVID is not gone. DC is open, but again, COVID is not over. So the only way we can get rid of this pandemic is to work together. And I think we've discussed many opportunities to make that happen. Please get vaccinated and boosted. I think that's essential, as Dr. Sommers pointed out. And you can get vaccinated through dc.gov. You can find a location, free vaccination or boosters, free take-home kits, PCR tests, and children and adult masks as well for your family that vaccinates stays together, which is needless to say an understatement. It's also essential to keep up with everything that's happening in DC healthcare, and to do that, there are some fun ways to do it. We do have our website, but we also have Facebook, Twitter, Instagram, and TikTok. So I want to thank you again for your time today, and I hope you have a great rest of your day, and reach out to us if you need us. Thank you.
Thank you, everyone, and have a wonderful day.